Hi, good evening, everyone. I hope you're all well and having a lovely Friday evening. So, I'm just going to wait for more people to join in. Hi. All right. Hi, Amritu. Hi. So, good evening, everyone. Welcome to today's live session. As you all know, this month is PCOS Awareness Month, so we at Girls Pass are doing our bit to help spread awareness on it, and which is why we have this special live session planned out for you. So, our guest for today evening is Dr. Pooja Gupta. She is a homeopathic doctor with years of experience, and she's the founder of Nari Aarogyam, which is an advanced women's health clinic which caters to every health concern that a woman might have. And their ideology behind their treatments is that they spend more time in investigating the root cause of the issue so that the health issue can be addressed effectively and efficiently. So I'm just going to quickly let Dr. Good evening, Dr. Pooja.
Good evening. How are you doing?
I'm good. How are you?
I'm perfectly fine.
All right. Firstly, thank you so much for doing this with us. We're super excited to have you on board.
Same here.
This is PCOS Awareness Month, and we couldn't be more glad to be doing this with you because you have years of experience in treating with disorders and health issues regarding women. And we have a bunch of questions planned out. So let's start the
Okay.
session.
So let's go ahead.
All right. So when is it that you came to know about PCOS first? I'm sure like you've studied and your education has also played a part in it. But when did you first come to know about it?
Okay, so basically, I have a medical background. My both parents are also doctor. My grandfather was also doctor. तो हमारे बीच में ये सारे discussions होते रहते थे. I never had any such kind of issues in my life, so I couldn't understand, what all these issues are practically. जब आप medical college में होते हो, you study them, you actually, study them for the purpose of just studying them, और ठीक है चलो अभी exams देने and everything. I literally did that. I have no problem in accepting that fact. But the day I started practicing, I was assisting my mother. I found कि and I think it was 7-8 years back जब मैंने उन्हें first time assist किया था and I found कि oh my God, the practice every day वो girls used to come with different problems, but this used to become the core of the issue. कि यार why everyone is having these problems like irregular periods, acne, hair fall, hirsutism, and I believe that point of time इतना awareness नहीं था. Even I would say as a doctor, I wasn't that much keen on talking about these things. So it was a surprise for me, and that was the time when I decided within 6-7 months कि you need to know it in a deeper understanding because उस टाइम पे मैं कुछ और डॉक्टर्स से एलोपैथिक डॉक्टर्स से भी गायनेकोलॉजिस्ट से भी कनेक्टेड थी एंड आई यूज्ड टू अंडरस्टैंड कि हम सबकी इस बारे में नॉलेज थोड़ी सी हिली हुई है एंड दिस इज नॉट टॉट प्रॉपरली इन आवर मेडिकल बुक्स क्योंकि इसके बारे में रिसर्च ही नहीं हुई थी तब तक एंड आई वुड से आई एम ब्लेस्ड कि I have seen the research done on PCOS from a very that level जब इसके बारे में बहुत ही मिनिमिस्टिक इंफॉर्मेशन होती थी just those 4-5 symptoms and now the research has gone to a level that we are able to predict and we are able to understand कि ये प्रॉब्लम अभी शुरू हुई है अभी आप इसको केटर कर सकते हो अभी आप इसको समझ सकते हो अभी आप इसके बारे में बात कर सकते हो so I believe that was the time 7-8 years back when I first time understood कि PCOS, PCOD, PCO is a biggest problem because इसके बारे में बात नहीं करते थे उस टाइम पे इतना. So that was my first experience with it. And I think that was the day and today is the day that journey has not stopped and I believe ये journey अभी बहुत आगे जानी है. Meanwhile, I also attained a PCOS educator degree from Australian University because this was a needed thing. I wanted to understand a lot about it. So I went, a little deeper into everything उससे related. I went into nutrition also, medical aspect also, and obviously homeopathic aspect also.
That's wonderful. And
Yeah,
I like the fact that you've gone in and studied specifically about it, to
yeah,
find a solution to it. Because any woman you speak to, most people they say they have PCOS. And
yes,
I also heard you saying these other terms like PCOD and PCO. So
yes.
what's the difference between these? Because a lot of people get confused. कि ये, मतलब, are they the same thing? What is it?
Yeah, so there is a very slight difference between all of these things, although the terms actually मैं clear कर सकती हूँ. So PCO is a diagnosis जो कि आपके investigation में आता है. आप गए डॉक्टर के पास, उन्होंने 2-3 symptoms देखे and they decided कि okay you go for the investigation. And major investigation जो उसमें होती थी वो केवल ultrasound होती थी at that time. तो it came out to be हाँ केवल polycystic ovary है, that is equals to PCO. जब वी फर्दर स्टडीड अबाउट इट, सो नाउ वी नो अलोंग विद अल्ट्रासाउंड हमें कुछ हार्मोनल टेस्ट भी कराने होते हैं जिसमें हमारे जो 4 मेजर फीमेल हार्मोन्स हैं, ईस्ट्रोजन, प्रोजेस्टेरॉन, एलएच एंड एफएसएच, हम उसकी वैल्यूज भी पता लगाते हैं. सो व्हेन वी फाइंड आउट कि okay so the ultrasonography is also showing a result of polycystic and the investigations are also showing the result of polycystic, तो हम उसको बोलते हैं polycystic ovarian disease, that is PCOD. Now, further, when we go into it, along with these investigatory finding, both the investigatory finding, that is the blood test, hormonal blood test, and your ultrasound, आपके कुछ symptoms भी होते हैं. That is irregular periods, acne, hair fall, और excess hair growth on the face. तो जब ये सब कुछ मिल जाता है, now it is being called PCOS. It is becoming a syndrome. So now this is a problem you need to deal with. Further, I would like to tell कि PCOS is also divided into 4 types. सो दिस इज नॉट समथिंग जिसको हम बहुत सिंपली क्वालिफिकेशन के हिसाब से मैं बता सकूं आपको कि क्वालिफाई कर सकूं कि ये है ये है ये है. बट येस व्हेन वी लाइक सिंस आई हैव स्टडीड दिस, तो आई नो हमें क्राइटेरिया वाइज अगर उनको देखें तो आप इनकी प्रॉब्लम्स बहुत अच्छे से सॉल्व कर सकते हो. पहले तो यही पता लगाना बहुत मुश्किल होता था कि पीसीओ है कि नहीं है. नाउ वी कैन गो टू द पॉइंट कि हम पीसीओडी और पीसीओएस में डिफरेंशिएट करते हैं. इफ पीसीओएस है तो हम उसको 4 टाइप्स में भी डिफरेंशिएट करते हैं, और वो जिस टाइप में सेट होते हैं. जैसे आप सुनते होंगे कि नाउ गर्ल्स हु आर लीन आल्सो आर हैविंग पीसीओएस, नॉट ओनली ओबीज जो हु आर लाइक पुटिंग ऑन वेट, उन्हीं को पीसीओएस है. सो नाउ वी डील विद देम इन अ वेरी आई वुड से इंडिविजुअल तरीके से, कि आपको वो नहीं करना है जो एवरीवन लाइक ग्लूटेन इज लाइक नो नो नो, milk is like no no no. So we actually try to tell कि कौन से में क्या नहीं होता. So when we can differentiate between all the 3 types, it becomes very easy as a doctor for me to actually give a proper treatment and a reversal for this problem, and also for the girl जो इतने टाइम से इस प्रॉब्लम से डील कर रही है, to understand कि हाँ okay now I am settled कि ये मेरा diagnosis है. Because when you know what is the problem, you are much relaxed. Because that's why
Yeah.
you go to a doctor ना, कि पता तो चले अभी हेडेक है ठीक है, पर कौन सा है, वी गो टू अ डॉक्टर टू आस्क दैट. सो आई एम इन द पॉइंट कि हम अब इसका आंसर दे सकते हैं. सो दिस इज द बेसिक डिफरेंशिएशन बिटवीन ऑल द 3 types of problems which come under the hormonal issues of females. Yeah.
Nice. I mean, I didn't know कि PCOS के, I mean PCOS के इतने types भी हैं. Uh,
Yes.
eye opener. So do you personally know any PCOS warrior in your own life?
Oh, yes. So, PCOS warriors are like, so there is an been a statistics which is there on internet that 1 out of every 5th girl is having PCOS. अभी मैं जब प्रैक्टिस में बैठती हूँ, आई फाइंड इट देयर इज लिटिल कुछ कंफ्यूजन है. बिकॉज अब मुझे ऐसा लगता है कि एवरी सेकेंड, थर्ड, फोर्थ गर्ल इज ऑल्सो हैविंग पीसीओएस प्रोबेबली. पीसीओएस वॉरियर्स आर द गर्ल्स जो कि एक्चुअली इसको बैटल करते हैं टू दी फैक्ट दे वॉन्ट टू फर्स्ट अंडरस्टैंड कि मेरी बॉडी में हो क्या रहा है, मतलब व्हाट इज रॉन्ग विद मी. सेकेंडली दे आर द वन हु रियली वांट टू कम आउट ऑफ इट. So my all patients who have PCOS, PCOD are my first warriors. I know them quite personally because I am that one person जो कि कोशिश करता है कि to understand the root cause, भाई शुरू कहाँ से हुआ है. And this is what I found कि stress is the problem. So personally they are my first PCOS warriors, but yes there are few family members also who are battling with PCOS, and I have seen them getting pregnant also with PCOS. I have seen them losing weight with PCOS. I have seen them battling with their acne and coming out with beautiful skin with PCOS. So yes, I have few PCOS warriors very closely connected to me also, and all my patients. They are equally, close to me as my family. So they all are PCOS warriors for me.
That's awesome. And I'm
Yeah.
sure you them all, in achieving it felt so good to hear those success stories because I've heard so many people struggling with it, not being able to get
Yeah.
pregnant and so forth. So that's really heartwarming. So have you ever faced any health issues that you want to talk to our viewers about? Because most
Yes.
we all think अरे doctors हैं उनको तो कुछ नहीं होता, like
Right.
just like उनको क्या हो सकता है, they know every treatment, they can look after themselves. So have you ever faced anything?
Yes, yes, yes. So that's like no one has ever asked me this question over a live session, and I believe personally भी बहुत सारे लोग नहीं पूछते हैं. So this is like first time I would like to tell you. I myself battle with fibroids, postpartum depression, and hypothyroidism. This all happened together within a phase of 1 and 1.5 year. I was dealing with all three of these issues, and frankly speaking, मैं खुद एक doctor हूँ. I can diagnose my issues, but when I was having those issues, I was not able to diagnose it. There were people around me, since I told you my parents are also doctors, homeopaths. My brother is also, my bhabhi is also. So they all were seeing what is wrong with me, and they suggested that you might be having those issues, so please don't ignore them. And I believe having a family like this really helped me a lot, because I could get to the like understanding, yes, this is the problem now, please take care of this. So and I was, frankly speaking, when I was going for postpartum depression, it was very tough time for me. I was not able to understand why I'm crying, why all these panic attacks. You name them after you have the episode. जब वो episode चल रहा होता है ना, आपको पता भी नहीं चलता that you're being crazy. The word is crazy, or you're being hysterical. But once the episode is gone, I used to realize I am doing something wrong within, my whole thing. And then slowly I started realizing. First वो realization ही आना मुश्किल हो जाता है. I was being made very aware by my parents. My father used to tell me, diet is one thing you focus on. My brother is a MD psychiatrist, so he used to tell me, take care of your mental health, because if you can't take care of your mental health, probably you won't be able to help other people. And I think this whole period of 1.5 years, when I was battling with all those things, became a part of my life. It became so important for me कि now when a girl comes to me with these symptoms, and they don't know that they are having these symptoms, it becomes like a goal of my whole thing of whole counseling on the whole treatment plan ki firstly I have to make her informed, I have to make her quite aware, and then make the family also aware about what she's going with. It's a very sensitive issues. And in India, sorry, but we all know it. Women's health is like the last priority until the women only don't take a part into this, right? So now, and I always tell these girls when they come with thyroid issues or they come with fibroids, I say, listen, I've gone through this. I have been on your place, so don't worry. I can actually understand the whole situations you're dealing with. And I believe when you have dealt with it, you become a stronger personality to understand कि सामने वाले का pain क्या है. So yes, I have been through hormonal imbalance myself, resolved it with the help of other doctors. I didn't self-medicate myself. That was the first thing I did. I didn't self-medicated myself, because आप usually अपने आप को self-medicate करके गलत direction में भी ले जाते हो. So I took help from my parents, and I was like, please do something, because I can't judge myself. So yes, I did that, and I have been through this. So it's nice to actually ask this question. Thank you.
Thank you so much for being so vulnerable and sharing something, as
Yeah.
personal, because it takes a lot. And I'm sure when people hear about it, they'll be a little bit more, reassured, and, that whole trust that, a doctor can have empathy with what you're going through. That's something that's unparalleled for a
Yeah.
patient. So my next question is, why do you think there is a sort of taboo associated with PCOS in our country? मतलब, in a lot of parts of our country, even urban areas and developed cities, we see that taboo everywhere. So why do you
Yeah.
think it is?
I'll tell you one thing. It is very similar to the fact कि जब पैडमैन आई थी ना, तो suddenly everyone was like, why is talking about sanitary pads? But the day it was released, within a week it became super hit. So the problem is not कि आपको पीसीओएस है, पीसीओडी या कोई भी इश्यूज है. प्रॉब्लम इज आप अवेयर नहीं हो या आप सामने वाले को पूरी सोसाइटी को अवेयर नहीं करना चाहते हो. डोंट वी टॉक अबाउट एड्स, डोंट वी टॉक अबाउट पोलियो, डोंट वी टॉक अबाउट कोविड फॉर एग्जाम्पल. यस वी डू. उसको उतना ही नॉर्मली नहीं लिया जाता है इन इंडिया. And I'll tell you few examples from my practice. Like there have been families where I suggest them कि you should go for an ultrasonography, and then I get to hear कि उनके घर का जो male member था, they suggested कि a girl shouldn't go for an ultrasonography before getting married. And I'm surprised why these thoughts are there in their mind. I don't know what made them think like that. But I believe the society has different thoughts about all these things. It's very similar to the stigma of menstruation now. People often make fun of you when you talk about menstruation openly. When I talk about what to use, whether you should use a sanitary pad or you should use a tampon or a menstrual cup. It's very, very similar to that. But most importantly is I believe there should be a humility in the male part of the society to actually let these girls open up, to let these girls talk about it. Stop calling them muchar or stop calling them, ganji oreo. I'm sorry, I'm being very gross about these things, but I hear them every single day being said to these girls about it. They just hear all these stuff. तुम इतनी पतली हो तभी तुम्हें पीसीओएस है, अब तुम इतनी मोटी हो इसलिए तुम्हें पीसीओएस. मतलब why are you judging them? So it's a very similar thing, and surprisingly, I would like to tell you that it's not just female hormonal health is the part of stigma or hypocrisy. It's also male hormonal health, because nowadays from last 6-7 months, I have been seeing a lot of male patients coming with their hormonal issues like thyroid. Why they don't have a thyroid or what? They also go through thyroid hormonal imbalance, and they can talk about it. They can tell कि हाँ मैं दवाई ले रहा हूँ उसके लिए. So why can't a girl talk about it? And mental health, it became popular after a movie came over it. So I believe अभी कोई मूवी बनी नहीं है पीसीओएस पे, तो कोई बन जाएगी तो हम लोग के लिए इतना उसको emphasize करने की जरूरत नहीं पड़ेगी. We would get some what I call them cheerleaders for us. कि okay, he's a cheerleader for me or she's a cheerleader for me. So the day that people got to know Sonam Kapoor had PCOS, everyone was like, wow, she lost weight. The day people got to know Soha Ali Khan, sorry, Sara Ali Khan had, so they were like, wow, she lost weight. Stop. The thing is, we always associate with those popular things. Stop associating with popular things, because this is a problem which almost every household is dealing with. And the thing is, as I started with, it has to be the male part also of the society to have this humility ki baat karo, matlab listen to them instead of uh, calling them different words, calling them like muchhad and all, which I'm very surprised they are actually being said like that. So this would make a little comfortable for them to actually go through this phase of coming out of this whole situation.
Absolutely. I think we need a society that's more informed and more supportive.
Yes.
And that can only come जब awareness होगा इसके बारे में.
Yes.
So my next question is, what is your take on women's health in our country today? Is it a matter of concern or denial? What is your take on it?
Okay, so women health has to be taken equal care, because if a woman in the family is not healthy, the whole family is supposed to suffer with them. Okay, I understand in most of the part of our country today also, the male is the earning member. But वो जो पैसे लेकर आ रहे हैं घर पे, the one who is supposed to cook for them, the one who is supposed to take care of the whole situation emotionally, physically also, is the female counterpart. but we don't. I today also see a lot of patients not being very concerned about what is going with their female counterparts. But I would say, surprisingly, in last 6 7 months, I've actually been connected with a lot of people around me, lot of families around me, जहाँ पे I see कि the males are equally helping the girls or the female part to come out of these issues, bringing them to our clinic. They really want to talk to me when the whole consultation is going on. They want to understand it. So I would say, yes, it is pretty bad at a lot of level. रूरल में तो बहुत ही बुरा है, पर अगर अर्बन की भी हम बात करें तो अभी शायद थोड़ा बेटर हो रहा है. एंड ऑल वी नीड टू डू इज वी नीड टू टॉक टू देम वेरी ओपनली, मेक देम पार्टिसिपेट कि यार ये देखो ये इशू है, listen to it. And I feel very happy with all those male members of the family जो इस चीज में एसोसिएट होना चाहते हैं. नॉट जस्ट दैट, यहाँ पे ना जो फीमेल्स है ना उसी फैमिली की, चाहे एल्डर फीमेल्स हैं who have gone through these issues, are supposed to be equally sensitive to the younger ones कि आपको ये सब issues हो रहे हैं, it's okay, let's deal with it. You should listen to them. First thing is listening to them. So like obviously women health is not that great. I can't say these things ki it is amazing or something, but yes, in my practice I try कि वो अच्छी हो जाए. मेल काउंटर पार्ट इक्वल पार्टिसिपेट करे, जितनी फीमेल्स भी आ रही हैं उनके साथ पूरी फैमिलीज आए, तो वो बहुत अच्छी एसोसिएशन हो जाती है. अगर किसी मेल मेंबर को ना स्लाइट सा स्किन इन्फेक्शन भी होता है ना, द होल फैमिली नोज अबाउट इट, the whole family is taking care of it. But we don't talk about females health. Oh, इसको periods हो रहे हैं, इसको रूम में रहने दो. you know okay, she needs rest, but she needs company also, she needs to be cheerful also. So these are the things where I believe I always tell them ki associate the issues with the mental health and the problems will be much better.
Absolutely. And we hope women don't have to suffer in silence anymore.
Yeah.
Yeah. So my next question is, how can Generation Z help in improving the quality of women's health? Because abhi ka generation to वही है, and what is your message to them? Like, what should they do to help?
I believe the Generation Z is actually being very, very active. बट उनके लिए जो सबसे बड़ा सोर्स ऑफ इंफॉर्मेशन है इज द सोशल मीडिया. And that's why I decided some months back last year that I need to come on social media, because social media में जरूरी नहीं है everyone who is talking is telling you to the right thing. But अगर हम जैसे like not just me, there are so many people who are talking logical, who are talking right, they are registered doctors. If we talk to them, if we give them information through our post, this live session, our reels and everything, they give them information. हम उनको information देते हैं जिससे वो aware होते हैं, and that awareness is then percolated throughout the slowly the percolation has started. Because अब जितने भी मेरे पास, I would say girls who are coming below the age of 25 are very well informed, quite well informed. They research beforehand कि ये issues हैं मुझे, ये problems हैं मुझे, and they want to talk about it. They're like, should I leave wheat? क्या मैं छोले भटूरे कभी नहीं खा सकती? Or like, shouldn't I drink milk? ममा से कि मुझे दूध पीना नहीं चाहिए. So they are quite informed now. And for that, I would like to like, this is the one thing, the social media platform has actually helped them to be informed and aware about whatever is going on. So this is one thing which is amazing for them. So Generation Z, you first need to be informed, aware, and then move ahead. Don't take any decision out of like इससे मुझे ये बोला, उससे मुझे वो बोला. No, take a solution or advice from someone जो इसको डील करता है, जो इसके बारे में जानता है, जिसने इसके बारे में पढ़ा है. आप प्लीज उनसे एडवाइस लो. And you have all the platforms open for you. Ask for the help and you will get it. So I think that's why Generation Z is also actually dealing with the whole situation. They ask for the help also. So they are not shy about it. They are quite frank talking about all these things, whether they want to have it or not, what to use in their sanitary issues, and they're quite open. I get daily DMs for that, and I'm very happy. I'm very glad when I can answer them, solve their solutions then and there, so that they're not confused throughout their life for this one small thing. So I believe awareness. Yes.
Absolutely. And, we live in the world, in the age of the internet. So, resources की कमी नहीं है and अच्छे and proper resources की कमी नहीं है. So people should reach out to
Yes.
the, people to get all the information that they need. So my next question is, I know PCOS या PCOD is like case on case treat किया जाता है. Each case will be different from another. But what are some common symptoms which people should not ignore? And once they see कि इनको ये symptoms हो रहे हैं, they should go to a medical professional. So what are these symptoms that people should not
Okay,
ignore?
so PCOS is quite confusing. The first 4 or 5 symptoms I'm gonna tell you are the one they are like, okay, this is the red line symptom. Now I need to see a doctor. First is irregular periods. If you miss your periods for more than 2 months, or if you find that your periods are not coming on time for more than 2 months, this is one symptom. You should see a gynac. Secondly, if you have any skin issues, maybe an acne or simple hyperpigmentation, or you're losing weight, or you're like gaining hair all around your face or on your body, is the second most important symptom. The next important symptom is your vaginal health. If you're regularly getting those itching and those white discharge, which we call leukorrhea, on and off, you need to see a doctor. Fourth one is, if you feel like that you have been working out a lot, or you're doing a lot of physical activity, you're eating proper food also, and still not able to lose weight or gain weight, it's both that way, you should see a doctor. So these are the important symptoms, I say. यहीं से आप पता लगा सकते हैं. And I would say the most important one जो सबसे पहले आता है, that is the mood swings. That is your mental health. The time you see कि आपकी mental health is affecting your menstrual health, या जैसे आपको कोई स्ट्रेस हुआ, फॉर एग्जाम्पल आपके एग्जाम्स हैं या एग्जाम्स डिले हो गए हैं, तो आपको या कोई स्ट्रेस है कि रिजल्ट आने वाला है, एंड यू फील लाइक मेरे पीरियड्स में कुछ डिले हो रहे हैं या मुझे पेनफुल पीरियड्स हो रहे हैं, दैट इज वन ऑफ द की लाइन सिम्टम. यू कैन एक्चुअली नॉट इग्नोर देम. और उसके साथ आप किसी भी गाना को मिलो, वो आपको आगे का पूरा फर्दर गाइडेंस देंगी. So these are the few starting symptoms. You can actually go through them. And इनके बारे में पता हो तो it's very easy to actually deal with this whole issue. You can't delay the treatment. आप जल्दी उसे catch कर सकते हो. बहुत ज़्यादा medicines नहीं लेनी पड़ती है. फिर छोटे मोटे dietary changes and you're fine.
Absolutely. It feels so good that you see, there's an easy solution because a lot
Yeah.
of people are, oh, PCOS is so hard to deal. अभी ये है तो बस life में इसी के साथ जीना है. So, guys, don't lose hope. We have doctors like Pooja, Dr. Pooja out there who are there to help you and guide you through, the problems. I also personally had a doubt. Like, can a girl have PCOS even if she's having regular periods? Like, is that also possible? Because a lot of people,
Yes.
if it's irregular, matlab you have it. But what if it's regular and you still have it? Um,
Yes, yes, there has been. So that's what I'm telling you. That is the PCOS type. So I was telling you the types of PCOS, if you remember in the first conversation we were having. So that is the PCOS type B,
okay.
जिसमें जरूरी नहीं है कि आपको इरेगुलर पीरियड्स हो. केवल पॉलिसिस्टिक ओवरीज आ रही है और आपको एक्नेज है या हेयर ग्रोथ है या हेयर फॉल है, तब भी आपको पीसीएस हो सकता है. सो दैट्स व्हाट आई एम टेलिंग यू. आप एक सिम्टम से एटलीस्ट गाइडेड हो, पर जरूरी नहीं है कि वो ही अकेला सिम्टम है. दैट्स व्हाई आई टोल्ड यू 5-6 सिम्टम्स. इनमें से कोई भी एक सिम्टम है, दैट्स बिकम लाइक हाँ मुझे दिखाना है, क्योंकि पीसीओएस विदाउट इरेगुलर पीरियड्स इज क्वाइट कॉमन नाउअडेज. ऑल्सो पीसीओएस विदाउट गेटिंग ओबीज, विदाउट गेनिंग वेट इज ऑल्सो वेरी मच पॉसिबल, जो लड़कियां मिस कर देती हैं. एंड आई रियली थिंक ये पता होना चाहिए. सो ग्लैड यू आस्क्ड मी दिस क्वेश्चन, बिकॉज गर्ल्स में ये कंफ्यूजन हमेशा रहता है. एंड आई बीन ये चीज का भी अवेयरनेस होना बहुत जरूरी है. राइट.
Absolutely, absolutely. I think the audience has a couple of questions. Hi, ma'am. I'm dying of thyroid, also very much stressed since last few months. Now I'm having severe headache. Is it connected with any kind of PCOS?
Can I see? Okay. uh
Yeah, it's the last question. Oh no.
Now having severe headache. Okay. Is this connected with any kind of PCOS? Okay. So I cannot say that it's a PCOS case or not, but yes, you definitely have started with your hormones being imbalanced. And PCOS is a type of hormonal imbalance, just like having a hypothyroidism or a hyperthyroidism. Heel ache जो आपको अगर हिंदी में बोलते हैं एड़ियों में दर्द होना, एंकल में पेन होना, is quite possible with two three things involved in it. One is if you have put on excess weight. Secondly, if your back is also not in a straight position throughout the day, you're bending a little more, so your nerves get pressed because of that. And obviously, अगर कभी भी confusion में हो, so there are like few 2 3 tests, you get it done, and your PCOS can be resolved. But since you told me that you're stressed already, then my dear, you're already having a hormonal imbalance, that is thyroid issues with being stressed. So you're only welcoming more hormonal issues with you. So please take care of that stress thing. You can talk to me about it. I'm open for that. But you start first taking care of that stress thing. And I believe बाकी सब चीजें उसके साथ ठीक हो सकती हैं.
Awesome. And someone has left a very sweet message that ma'am is trying to protect all the girls out there, especially those who are suffering from this disease.
Oh,
And I'm very lucky to have her. Thank
thank
you.
you.
Okay, I'm just trying to see if this. Yeah, so there's another question, ma'am. For treatment, where can I meet you? So yeah, this is an important thing. So where can people connect with you on a one-on-one basis?
Okay, so the thing is, since the COVID era started, I have been giving online consultations also. So you can connect me over my Instagram handle, that is Nari Aarogyam. I'm there on Practo also. I have a website with the Nari Aarogyam, www.nariaarogyam.com. So you can reach out to me on all the three platforms anyhow. If you reside anywhere near Meerut in Uttar Pradesh, so feel free to actually come down to our clinic. You'll feel a different vibe over here. We have a lot of activities always going on in our clinic. It's situated in Shastri Nagar, Meerut. For the full address, you can actually DM us and we can send you the location for it.
All right, awesome. And guys, we will be, saving all these links and putting it up as this, live session will be saved, so you can even access it from there. So yeah, my final thing is, what is your one message for all our lovely audience over here?
Oh, okay, now. So my final message to all girls and all the people, not just girls actually, everyone who has joined us today, that whatever little information, I believe I would have added some information to your knowledge which you already had. That little information also, please try to, deliver it to maximum people out, whom you know might be having these issues, and talk to them about it, because these are the things which only be solved when we talk about it. And when it comes to female health, problem यही है कि we don't talk about it. So my message to everyone is, please बात करो इस बारे में, because this is very very important. Talk, and then ask, seek for the solution. And you can't seek for the solution until you don't ask for the help. People are just don't know that you have this issue or something. So seek for the help, and I think your solutions will be anywhere in the world will reach to you on time.
Absolutely, and I couldn't agree with that more. So, Dr. Pooja, thank you so much for taking out your time and joining us for this lovely session. I'm sure everyone has gained some information or the other from this, and yeah, so thank you so much for doing this with us, and we hope to do this sometime again with you.
Thank you so much, and I really love your post. I was going through your post a few days back. There was a post about feminism, that it's not about we hate boys or we hate the male, and I really love your post. So continue doing this work, because it's amazing. Because you are the people who are actually giving awareness to the Gen Z. So keep doing this, and I'm very happy that you connected with me. You asked me some of very personal questions also, which I believe I couldn't have answered otherwise. So thanks a lot. It was wonderful talking to you.
Thank you. Thank you so much. All right. Have a nice day and a lovely week. And thank you
Thank
everyone
you.
for